Good afternoon, everyone. Thank you for being here today. I'm joined by Commissioner DeRaza and our Police Commissioner, Michael Harrison, for an update on COVID-19 in Baltimore. We continue to monitor our COVID-19 metrics in accordance and stay focused on our approach to this pandemic, which has been, as you know, focused on public health and navigated in partnership with our world-class hospitals and health experts here in the city of Baltimore. I have been continuing to visit our mobile vaccination sites across the city. I was just out in East Baltimore earlier this morning, where we have residents who are ready and happy to get vaccinated. So that the folks who keep continuing to say that people in the city, in particular African Americans, don't want to get vaccinated, they're not seeing what I am seeing when I go to these vaccination sites. I truly appreciate that enthusiasm of our residents, and we know that will help to spread the word about how safe this vaccine is throughout our city. I'm proud of our health commissioner and our health department for continuing to focus on equitable distribution of this vaccine. And before I discuss things any further, I want to turn it over to Dr. DeRaza for an update of where we stand and to share an exciting announcement about a new way for Baltimore residents to be matched with vaccine appointments. Dr. DeRaza.
Good afternoon, and thank you, Mayor Scott, for your leadership during these challenging times. Baltimore City has recently seen an increase in many of our key indicators, including cases, positivity rate, and hospitalizations. While this is not news I want to deliver, in light of the holiday weekend, I want to ensure that Baltimore residents understand how this new surge is different. Today, I will briefly talk about who it is affecting, how vaccinations continue to play an important role, and the personal responsibility each and every resident needs to take in order to care for themselves and their loved one. We'll begin with a review of the latest data, also available on our public-facing dashboard. Our latest 7-day average new case count is 174 cases per day, a 143% increase from 4 weeks ago. Our latest 7-day average positivity is 3.7%, an increase of 106% from 4 weeks ago. To put this in context, we compare case rates per 100,000 residents to adequately account for population variations and to make apples-to-apples comparisons. This week, Baltimore City is averaging about 29 cases per 100,000 residents, a higher rate than both the state of Maryland and the U.S. as a whole. Our hospital utilization rates have remained consistent, with ICUs at 87% capacity and acute care units increasing slightly to 88% capacity. Fatalities due to COVID-19 are now averaging approximately 2 deaths per day. As of yesterday, we have lost 848 lives to COVID-19, and we have seen 44,609 confirmed cases of COVID-19 here in Baltimore. The new wave of COVID-19 is striking at a time where we are seeing more and more vaccines being distributed in Baltimore City, which has changed the profile of the average COVID-19 hospitalization. This week, 25% of Baltimore City residents overall, and almost 50% of residents 60 and over have received at least 1 dose of the COVID-19 vaccine. 14% of all city residents are fully vaccinated, while 27% of residents 60 and older are fully vaccinated. When we take a look at the age breakdown of COVID-19 cases, we can see differences in how the vaccines are affecting the health of our residents. For more than a year, residents 70 and older have consistently experienced among the highest incidence rates of COVID-19 cases across all age groups. However, beginning in early March, for the first time during the pandemic in the city, the weekly COVID incidence rate for ages 70 plus years are the lowest among all age groups. What this indicates is that vaccines work. Younger cohorts, specifically those aged 20 to 29 and 40 to 49, are now the leaders in new COVID-19 cases. Essentially, Gen Z, millennials, and Generation X are contributing most to the rapid rise in case counts here in the city. It remains vital that Baltimore residents get vaccinated as soon as they are able. With the Maryland Department announcements that by April 27th, all Marylanders will be eligible to receive vaccine, we have created a vaccination pre-registration portal for all Baltimore City residents aged 16 and up. It can be found at covax.baltimorecity.gov. There are no longer separate forms for separate populations. We are now using one single form to pre-register all eligible city residents, which again, by April 27th, will be everyone over the age of 16. If you have already registered with us, you do not need to use the new portal. You are already on our list, and our team will contact you once a vaccine appointment becomes available. We encourage city residents with access to the internet to begin pre-registering for the vaccine now, and we will be announcing plans for those without access to the internet to register in the weeks to come. I'd like to be very clear on this point. This list is not first come, first served. We continue to have limited quantities of vaccine supply and focus our efforts and attention on vaccinating those that are higher risk first. Eligible older adults, those who have intellectual or developmental disabilities, or their caregivers should also fill out these interest forms, which include a question about whether the individual seeking a vaccine is homebound. This information, again, will inform our outreach efforts over the weeks to come. Those individuals can still call the Maryland Access Point line at 410-396-2273 if they don't have internet access, and a representative will help them fill out their form. As we head into another holiday season, I'd like to take the opportunity to remind residents that while we are all anxious to see our loved ones, the CDC guidance is clear. Only fully vaccinated individuals can gather indoors with other fully vaccinated people without wearing a mask in private settings. Additionally, if you are vaccinated, the CDC says it's okay to gather indoors with unvaccinated people from one other household without mask, unless any of those people or anyone they live with has an increased risk of developing severe COVID-19 illness, again, only in private settings. So unless you've been fully vaccinated, you should not be celebrating the holidays in person with your mask off with those outside of your immediate household. And you should not be anywhere in public without a mask, whether you have been vaccinated or not. There is no longer an excuse for ignorance. At this point, our residents are aware of the simple rules that will save lives because public health professionals have been saying this for over a year. At every single press conference, we have asked residents to wear masks, to practice social distancing, to avoid large gatherings, and to wash your hands. Please stay home if you're not feeling well. Get tested if you have symptoms of COVID-19 or have been exposed to someone with symptoms of COVID-19. It's no longer a question of whether individuals know how to reduce disease transmission. It's a question of whether Baltimore City residents are willing to do it. This weekend, as you finalize your Easter holiday plans, make sure that you're taking into account the personal responsibility each one of you have to protect the lives of your loved ones. No longer just our grandparents, but now our mothers, our fathers, our sons, and our daughters. We are vaccinating, and every vaccination is a victory in the fight against COVID. But every party, every visit to an unvaccinated friend or family member, every time you leave the house without wearing a mask, you're potentially pushing us one step back. We are so close to winning this fight. Please, Baltimore, continue to follow the public health guidance to save lives, and when you can, please get vaccinated. Thank you.
Thank you, Dr. Terraza, and thank you for your kind words and your leadership throughout this pandemic. And this is not an April Fool's joke. Baltimore residents now have access to a one-stop for local COVID-19 vaccination appointment. Thanks to the innovation of Microsoft, Baltimore residents have the ability to pre-register for vaccinations as they become available. This partnership between Microsoft and the health department is another example of how collaboration can streamline the vaccination process and safeguard the public health of our residents. Again, the vaccine pre-registration portal can be found at covax.baltimorecity.gov. That's covax.baltimorecity.gov. We will continue to innovate in Baltimore so that we can best serve our residents and ensure that our most vulnerable communities are not left behind. And at the same time, we are, as you heard from our health commissioner, seeing cases rise, not just in Baltimore, but across the state and the country. And whether you or not are one of the 25% of residents who have received one dose of vaccine, I'm asking that you continue to take COVID-19 seriously, exercise extreme caution. We have lost 848 people to this pandemic. We are losing 2 a day. This is not over. We are a long way from this being over. And in particular, you've heard us say this time and time again, for the younger people, 20 to 29, 40 to 49, and the next group is 30 to 39. You can get sick too, especially with the new variants that are making younger people sicker than the original variants. Do not relax yourself. Do not be so irresponsible with your life, the life of your mother, your father, your brother, your sons, your grandparents, because COVID is real and COVID is still killing people across Baltimore. Don't become a meme of these folks who are out at these parties with no mask or having events and ending up on someone's Instagram feed because you were irresponsible. That's not the way that we want to go here in Baltimore, especially as we move into the holy holidays and weekends that we know people want to get together. Do it in a safe way. Do it in a way that meets the guidelines. Always wear your mask. Don't intermingle. Follow the CDC guidelines. Listen to what our health commissioner is saying so that you can be just here to celebrate Easter next year with your family, so that hopefully by next year we can go back to the traditional Easter traditions here in Baltimore, where there are the kiddie discos and all the things that we know and love about those holidays here. The only way that we're going to get there is if people absolutely have to be responsible. And that's the way that we're asking people to move forward, because this pandemic is not over. We have taken care throughout this pandemic to follow the data and make responsible decisions. And we do not want to backtrack. And I need every resident to continue to take this seriously so that as we get people vaccinated, we can make it through COVID-19 together. And at this time, we'll take a few questions. Sir?
Hello, Mayor.
How are you today?
Good. How are you doing?
I'm good.
I just wanted to ask your general reaction to the issue that happened at Emergent with the ruined vaccines. Were local officials at all aware of this? Are you worried about supply issues? And are you worried about this creating some trust issues?
Well, I think that it's unfortunate. We know that anytime you have humans involved in something, there's going to be human error. We know that it is impacting theirs, but we are still getting shipments of other vaccine. I'll let the health commissioner talk about how it may or may not impact our operations, but it's just an unfortunate thing, and we have to continue to push through that. And as someone who actually received the Johnson & Johnson vaccine and know it's safe, I'm just going to let people know that it is, and we just have to make sure, and we've seen that they're putting things in place to try to prevent things in the future. Dr. D?
Yeah, no, I mean, I think Mayor Scott is spot on. We've had no indication that this will affect our supply from the state at all.
Thank you.
Dan?
Thank you, Mr. Mayor. I have two questions, if that's all right. One is about the new portal. Will residents be able to look on there for places like private businesses as well, CVS, Safeway, as well as the mass vaccination sites and the one at BCCC?
Yeah, I'll let Dr. D come up, but it's about you giving the information to us, and our folks will contact you about where to go. They're not going and selecting. We are taking the information so that we can assign our residents to vaccination appointments that become available, eliminating that step for them that has been very confusing and hard to navigate. We hear that time and time again. Dr. D?
Yep. No, Mayor Scott is correct. This is intended to be a one-stop pre-registration application. And so we receive the information on the back end, and then we can schedule individuals as appointments become available. So no searching around for locations. We would reach out.
And that's live right now?
Yes.
Yes, it's live to go. Covax.baltimorecity.gov.
And another question, if I may, real quick, either to you or Commissioner Harrison. This was just something that was said last night during the public safety hearing with the City Council regarding the state's attorney's office's new policies regarding low-level offenses. And the commissioner had mentioned a little bit that there was a lack of clarity in some way with some of the definitions for things like simple possession and such. And I'm looking to see if you can either talk about how this may affect the job of police officers on the ground with that lack of clarity?
I'll let the commissioner speak to what he said last night. I don't ever want to speak for another person for something they said, and I might have follow-up for you. Mr. Commissioner?
Thank you, Mr. Mayor. I don't know that I recall saying it was a lack of clarity. I think I was talking about what we teach officers to look for in the criteria which would allow a case to be a distribution case, which we are pursuing individuals who are distributing and selling illegal contraband, and possession with the intent to distribute because it's packaged a certain way. Are there other observations the officer made or some other witnesses giving us about people selling drugs and what needs to go into the report to constitute probable cause for those kinds of cases? And so we give guidance to the officers about that. However, over a year now, we have not been making those low-level offense arrests for just simple possession. However, we still remain dedicated and vigilant about going after people selling drugs in our city.
Do you feel like you have enough information from the state's attorney's office, though, on what exactly your officers should be, following there on the ground?
Well, she and I have spoken on many occasions, and there are other attorneys there that have communicated with other members of our department. And based on that policy change, we made the adjustment to know what we're going after because we're teaching what constitutes possession to our officers. We're teaching what constitutes distribution to our officers. We feel that we have people who have that knowledge, and those officers need to have some level of discretion in the field to be able to make those judgment calls, especially with some supervisory oversight. But we feel we've had enough information and enough communication to know how to make a good informed decision.
Thank you, Mr. Commissioner.
Thank you.
And Dan, just as Avajoy comes up, come on, Avajoy. It's just, again, I think it's very important that we just remind you that we've had recent organizational takedowns. Pennsylvania Avenue, Penn and North, there was a big takedown recently. We know the one in Southwest that happened a few months ago. This is about focusing in on the people who are driving violence in Baltimore through drug organizations and going again, allowing the police department to focus on that and not having them go after people who have substance abuse issues who are not inherently criminal. We need them focused on the people that are driving drugs and violence through organizations, and that's what they will continue to do. Avajoy?
Hello, so this question is for Dr. Duraza. I don't know if I heard you correctly, but I think you said there are higher rates of COVID-19 here in Baltimore, higher than the state and then the U.S.?
Higher, when we look at case rates, so we sometimes will look at something called new cases per 100,000 residents, and we are now sitting at 29, which is above the level of the state and the U.S.
Okay. Can you just kind of reiterate for us how concerning it is, and why is it that Baltimore is at a higher rate out of all the jurisdictions according to your calculations?
Sure. So I think we talked about it throughout the press conference, right? We need people to continue doing all of the things that have kept us safe. We know that there's COVID fatigue. We know that people want to spend time with their families. We know that there's been increased mobility for the past month, that people are moving about as if there is no longer a pandemic. We know that only about a quarter of all people in the city have received at least one dose of vaccine. And in order to be fully vaccinated, you have to be 2 weeks post 2 doses for Pfizer and Moderna, and 2 weeks post the 1 dose of Johnson & Johnson. So just getting the vaccine, it takes some time for you to actually be fully immunized. So we need people to continue to exercise the exact same caution, and my concern is that people aren't doing that. So we're seeing these new cases rise, especially among younger people. Our older adults who've been vaccinated, we're seeing their case rates go down. We know vaccination is effective, but it is not widespread enough where we can stop doing all of the things that we've been doing.
And I'm curious about the hospitalization rates. Are we seeing younger people being hospitalized as well?
We are, and I think that's also an important point to make, right? In the beginning of the pandemic, there was so much attention and focus on our older adults. We know they get more sick. We know that their disease tends to be severe, but especially with the variants, we're seeing younger people hospitalized. We're seeing younger people get ill. When I speak with hospital colleagues, they say, a third of people, all the people come in, even though they're younger, still end up in the ICU. This is still a very dangerous disease. It's still a deadly disease, even for young people. So we all have to be cautious.
Okay, and I'm just also curious about the influx of people into the hospitals, because that has always been an indicator of where we are going.
Yeah.
Are the hospitals, will they be able to handle what is to come?
And so in talking to colleagues, it sounds like they're holding steady, right? So we're seeing this increase. The one thing that has improved is because many health workers are vaccinated, there has been less call out. So I've heard that anecdotally from colleagues. So that helps with overall staffing, right? Because it's not just beds, it's do you have the staff to cover those hospital beds? So less call outs overall, which is a good thing, but there's still certainly folks coming into the hospital. Pretty steady, not as high as it was in the winter. Again, this is anecdotally talking to colleagues, but certainly we've seen some increase in admissions.
Okay, and Mr. Mayor, thank you. If you could just address this young people issue. I know it's been said that people are going out to bars and restaurants. I know you have also been hesitant to open up as quickly. What are your concerns and what are you looking at in 3 weeks after now when they say the surges are usually coming? Could there be a fall of restrictions here?
Well, we're always going to follow the data, and we know that I will be willing and able, and I will do whatever is in the best interest of the public health of our residents. But I think it's important what Dr. Jaraza is saying, and I want the younger people in the city to hear me very clearly. You are not invincible. You can end up on a ventilator just like your grandmother or your grandfather. This is not COVID as we knew it in the beginning. Young people get sick too. I've heard it from our hospital partners. I hear it from Dr. Raza. We have to understand that everyone has COVID fatigue. We know the weather's getting better, but it's not the time to be reckless. It is not the time to be stupid, to be quite frank, and go and be in places in unsafe ways. It's very easy to protect yourself. Follow the guidance, wear masks, do the things that we have been beating people over the head about for over a year now, because it's not just about whether now at this point, whether you can make your mother or your grandparent or someone who's an older adult sick, you might get sick, or it could be both. You have to think about things greater than yourselves, but also about keeping yourself safe. And we're going to follow the data and make our decisions as we always have.
Okay, thank you.
Emily, thank you for making my true Mervo track form go viral.
Regarding the vaccine registry, I'm sure people are excited to have it, but is there a reason it took this long to stand up, and does it have any more capabilities than, say, ones offered by surrounding jurisdictions?
Yeah, I think everything's always a process, Emily, and especially when you're talking about building systems and computer systems, but I'll let Dr. Jaraza go into the details.
Yeah, Emily, so initially we, like the surrounding jurisdictions, were using PrepMod, which is a state-supported system. As we were experiencing some of the challenges with PrepMod, we began to look for alternatives. So this is an alternative that's built on the Microsoft platform to PrepMod. We found that it's far more user-friendly and have been able to configure it in a way that supports our needs. And so, again, as Mayor Scott mentioned, it takes a little bit of time. We wanted to get on that platform, and we wanted to make sure we had all of the specializations and customizations that we wanted in place.
And Emily, it's really about building something that's right for our citizens versus getting something out quick. Doing it the right way that will have the impact and have the accessibility and have all of the things that we need for our residents is the responsible way to move. And that's why the Health Department, the Health Commissioner moved in that direction.